One of the many things you learn as a clinical medical assistant is how to properly take someone's temperature. Here we see that Alec is making sure the probe or the thermometer is properly placed under Natalie's tongue to ensure an accurate reading. Here we can see that Natalie has a fever and is on the verge of dying.
We have a fever outpatient.
One of the other forms of vital signs is blood pressure. When I took Gabby's blood pressure, it was 110/60, which is normal for an athlete like her. When taking her blood pressure, I make sure I have the right size cuff for her small chicken wing arms. In this video, Gabby is performing a dermal puncture. Dermal punctures are performed to check things such as iron and blood glucose level. When performing a dermal puncture, it's important to make sure that the site of the puncture is properly cleaned with an antiseptic wipe. It's always important to inform your patient of every step of the procedure that you're about to perform on them. Some patients may be apprehensive about dermal puncture since there is blood involved, like Natalie was here. When patients are scared, it's important to reassure them that it's a quick and easy process that will be over shortly. After dermal punctures are performed, it's important to apply pressure to the site to stop bleeding. In this video, Natalie is performing a venipuncture. The first step in venipuncture is applying the tourniquet to be able to find the vein of the patient. Here we see Natalie feeling for a suitable spongy vein to draw from. After finding a vein, her next step is to put on gloves and prepare the rest of her equipment. Natalie then makes sure to clean the site of the draw with an antiseptic wipe in circular motions. After preparing the rest of her equipment, she applies the tourniquet again. Now it's time to draw. Sometimes draws may be unsuccessful, which is okay. It's important to stay relaxed and try again. Here we see a successful draw by Gabby. We can tell it's successful because blood has entered the tube. After drawing, make sure to recap the needle and apply pressure, disposing of the needle in the sharps container. It's a wrap! A special shout out to MrsY and all she's done for us over the years.